Welcome to Knowledgeable Aging. I'm your host, Jason Kotar. Joining us today to talk about exercise basics for older adults is Katrina Wolf. Katrina is the owner of AgeWell Senior Fitness. She is an ACSM certified personal trainer and ACE certified senior fitness specialist and has over 20 years experience as a licensed physical therapy assistant working with the geriatric population. How are you doing today, Katrina?
I'm good, Jason. Thanks for having me.
Good. Finally got you to collaborate with us, so I am excited. But before we get started, Katrina, for those that are joining us for the live webinar, if you have any questions, you should see a control panel or toolbar on your right-hand side. If you have any questions, type those questions in, and time permitting at the very end, we will do everything in our power to get your questions answered. Okay, Katrina, I'm going to turn it over to you.
Okay. All right. So today we are talking about the exercise basics for older adults. And when I say older adults, I'm including basically 65 and older. And I am going to include some ideas for people with less mobility because I really feel like that's a population that is overlooked in the fitness industry. They focus a lot on active agers, but there's a whole group of people that are homebound and still need to exercise and be active, or they may even be living in a wheelchair or using their bed most of the time. So we're going to talk a little bit about that as well. So the 65 and older age group is one of the most highly variable age groups when it comes to function and ability. You can have someone in their 80s who can run marathons, or people who are in their 65 who might be using a wheelchair or have significant health conditions. So it is a huge population to try to address when it comes to fitness and exercise. And like I said, I think that we see a lot about prevention, which is important, and wellness is important. So we'll talk a little bit about the different components of what would be the ideal exercise program. And then at the end, we'll talk a little bit more about other populations who might have more mobility challenges. And then I'll give some ideas about where you can look to find resources for yourself or your loved one, because oftentimes it's family members looking to help with the mobility for their spouse or their parent. So here's the discouraging news and why exercise is important. We start losing muscle mass in our 30s, and we will continue to lose 10% per decade as we age. I know when I read that, I was 40 and I was really kind of sad about it, but loss of strength is one of the most common reasons people need assistance in their home. So when people hire home healthcare aides to come into the home and help them with dressing, bathing, that type of thing, it's usually because people have lost strength or balance to the point of where it's difficult to do those most basic tasks. Our bones become more brittle and susceptible to fracture and osteoporosis. Heart and blood vessels become more rigid, and then we have a decreased blood flow to the brain, as well as a decline in the receptors and pathways in the brain. So these are all things that happen as we age. So how can we improve all of this? Exercise. Exercise is medicine. There's no magic pill. There's obviously some medications for osteoporosis, but when it comes to building muscle and keeping yourself healthy, exercise is your one-stop shop for slowing the aging process or aging well. So is it safe to exercise as we grow older? The answer is yes. Always check with your doctor before you start a program. If you've had any kind of history of cardiovascular disease in your family, they may want to do a stress test. If you or your loved one's mobility is extremely impaired and you have had a history of falls or significant difficulty getting around, get a referral to physical therapy. They can be your gateway into a more active life, because often people have concerns. Am I going to hurt myself, or is it safe for me to exercise? But you should always have a plan on how to continue after PT, because PT is not forever. It's usually for a certain amount of time to address a certain issue. And then after that, you should have a plan in place on how you are going to continue maintaining those exercises or activity level. So how much activity should we have? The ACSM, which is the American Council of Sports Medicine, they set all the guidelines for exercise. They work with physicians, physical therapists. When I worked in therapy, we follow the ACSM recommendations. So for adults over 65, you need 150 minutes of moderate activity a week. That's 30 minutes, 5 days a week. Activity can be beneficial in 10-minute increments. So you don't have to do the entire 30 minutes at one time. If you have 10 minutes in the morning, 10 minutes in the afternoon, and 10 minutes of the evening to do some sort of moderate activity, that still shows the same benefit in research as doing 30 minutes straight. 2 days of resistance training. Resistance training is strength training. And neuromuscular and balance training should be part of your exercise program, especially if you're over 65. So that sounds like a lot, especially if you're not doing anything or if you're not able to do a whole lot. I know in my years of working in physical therapy and then in what I do now as far as exercise instruction for adults in their homes, oftentimes, I have people that can't tolerate more than 2 or 3 minutes of activity. So that 150 minutes seems like really far away and something that's not achievable. But always remember that something is better than nothing. It's better to do a couple minutes of activity. If that's all you can tolerate, then that's better than being sedentary and not doing anything at all. So don't let those numbers scare you or discourage you from trying to increase your activity level, and start where you are. If 5 minutes is a lot for you, then aim for that 5 minutes and then try to increase it by another minute. Don't let the 150 or 30 minutes or even the 10 minutes be something that holds you back from starting a more active lifestyle. So strength training, this is my soapbox. I drive through the senior living communities and I see all kinds of people out for walks, and walking is a fabulous cardiovascular exercise. It keeps you active and mobile. It can be a great social activity to do with your friends. However, it's not enough. Research shows that a progressive strength training program is beneficial for everyone, but especially for older adults. And that is because the loss of muscle mass, back to that loss of muscle mass after you turn 30, if you're doing the same thing over and over and over again with the 2-pound weights, that's not a progressive program. Progressive means to increase the volume of your exercise. You can increase the volume of your exercise through the number of repetitions you're doing, how heavy your weight or resistance is, the number of exercises, and also by changing the speed of the exercise. So increasing the speed of a certain exercise can work the muscle in a different way, which increases something called power, which is another component, can be another component of exercise programs. So a little more about strength training. So to build strength, you should aim for 8 to 12 repetitions of each exercise, 2 to 3 sets of each exercise. And the weight should be enough that the last couple repetitions should be difficult. You should be thinking, whew, I'm glad that's over, the last couple of reps. If you can easily do 3 sets of 12, or if you're doing 20 repetitions, you need to change something. You need to most likely add your weight. If gaining strength is your goal, if you're looking to get stronger, then you need to constantly be changing that volume. And to build strength, you need to increase your weight. Now, I want to say that you should be able to do those exercises with proper form. If you're substituting by shrugging your shoulders or using your body to lift the weight, that's not proper form. You're using other muscles. So 8 to 12 repetitions, 2 to 3 sets using proper form, with the last several repetitions being somewhat difficult. If that's not where you're at, then you're not really building strength. You should increase your weight. To build muscular endurance, this is a different type of way to work the muscle. For this, you would do 15 to 20 repetitions, 2 or 3 sets, and you would use a lighter weight. You should still be, the last couple repetitions should be somewhat difficult. This type of exercise training can actually help improve your cardiovascular activities, like walking or cycling. So, even your athletes that do cycling or your athletes that run, they will have a weightlifting program that may incorporate some of these concepts to help build the muscular endurance that they need for their endurance sports. But for ourselves, as we age, endurance is also important to be able to do things for a longer period of time, ADLs, cooking, taking care of your home, going shopping, those types of things. Balance training. This balance training is more than just standing on one leg, and it is a must-have as we age, because as we age, oftentimes our systems of balance can kind of decline some. So there are several systems of balance. We use lots of things to keep our balance. Our vision is one of the biggest things we use to keep our balance. Our proprioceptive system, if you think about feeling your feet on the floor and feeling the floor under it, if you're on something squishy or uneven, it's a little harder to keep your balance because your proprioceptive system isn't getting as much input. And then your vestibular system, your inner ear. And then your brain takes the information from all of these systems and then, you know, takes it in and then tells your body what to do to keep your balance. A good balance program should address all of these components. They should address the proprioceptive system and the vestibular systems. If you have balance issues, you should have your eyes checked. Make sure that your if you have corrective lenses, that they are the proper prescription for you. When you are doing balance activities, you should be careful. It's kind of a dicey situation because you want to challenge yourself. The learning is in the struggle, is what I tell my clients. If you're not struggling a little bit to keep your balance, then your body isn't learning to improve its balance. So the learning is in the struggle, but you should still do active balance activities in a safe position. So next to a counter, in the corner, or having somebody to stand by for safety. I know we do virtual sessions, and my trainers that do virtual sessions, if they're going to do balance, they sometimes have to have somebody come and stand next to the person if they're really impaired, to be able to get the most out of the balance activity. If you're able to stand on one leg very easily with no struggle, we need something a little more challenging. So like I said, all those different systems of balance should be addressed when you're working using balance exercises. Again, learning is in the struggle. They should be challenging. You should be struggling a little to keep your balance, and then use a spotter if you're doing something very difficult. Posture and flexibility. So our daily activities as human beings tend to pull us forward anyway. We sit in our cars, we sit at our desks, we sit and read, we sit in our recliners, we slump forward, and then osteoporosis can just accelerate this process by the bones kind of compressing and then bringing you forward as well. When your posture is not good, you can have joint pain, of course. Your back hurts. People can get headaches from that forward head position that you're in. Also, when you're slumped forward and the ribs kind of collapse down towards your pelvis, you can have difficulty with digestion, breathing. I know when I worked in therapy and we worked with COPD patients, we talked a lot about posture to be able so the lungs can pull the air in. If you're smushing them down, they can't work. And then organ function and circulation. So having good posture is really important for just basic health in general. Also, if you have a forward head posture and kind of leaning forward at the hips or the back, that affects your balance. It throws you off. We best keep our balance when we're in a straight line, head over shoulders, shoulders over hips, hips over feet. And when you have your shoulders forward, then it's more difficult to keep the posture because your weight is pulling you forward, and that affects your balance. So of course, just like everything else, we lose flexibility as we age, and decreased flexibility can lead to all those things we've talked about, muscle imbalances. So if you have a forward posture, your chest muscles will be tight and your back muscles will be stretched out. And when those muscles are stretched out, they don't work as well. They don't have as much contractibility to hold you up and keep you with good posture, and they become weak. So people that spend a lot of time sitting, their muscles will get tight. And this is not just older people. I remember very clearly many years ago, I had a gentleman as a therapy patient, and he had a knee replacement. So we were there for his knee replacement, and he was in his late 50s, kind of young for a knee replacement, but he had the worst contractures in his hips. He was bent forward really bad. He was a heavy equipment operator. He sat 12 hours a day, you know, in heavy equipment, operating heavy equipment. So you don't have to be over 65 for those things to happen to your muscles. You can still get tight muscles, especially if you sit for a long period of time. We actually spent time working on getting him a little more upright. So if you are doing stretching as part of an exercise program, something to think about, you don't stretch a cold muscle. So people think that they should stretch before exercise, which is fine. Stretching before exercise is great, but you should not start with the stretching. You should start with a warm-up. A warm-up could be a walk, marching. I have like a 5 to 10 minute warm-up I do with my clients. Some of my clients warm up before I get there, but you don't want to stretch a cold muscle. I often save stretching for at the end of the workout when the muscle's nice and warmed up. It just depends on the person. Like if you have athletes, sometimes they need to do stretching first, but for my clients, we usually do it last. So a warm-up is important. When you're stretching, you need to hold those stretches for at least 20 seconds. Research shows that 60 seconds overall actually helps to change the length of the muscle. So I usually recommend 3 times for 20 seconds each. Get your total of 60 seconds. Don't bounce. If you see people bounce, stretching their hamstrings, that actually bouncing or pulsing actually can increase your risk of injury because it signals something in the muscle that causes it to have a quick contraction. So you want to hold a nice static stretch. There is something called dynamic stretching, which is really good. So when you move and stretch at the same time, you should probably have some guidance on how to do that. And don't hold your breath. Breathe normally while you're stretching. Take a self-check. Am I holding my breath while I'm, reaching down to stretch my hamstrings? Holding your breath is definitely not good for you unless you're underwater. Then I recommend it. The body parts that most of us need to stretch the most are our chest muscles from that forward posture we have. And even if you're a reader, reading, driving a car, all these things that pull us forward. Hamstrings, and that is the back of the upper leg. Hips, the hip flexors in the front of your body, where your thigh meets your pelvis. Those are notoriously difficult to stretch, hip flexors, but they are notorious for causing lots of problems, such as back problems, especially back problems. And calf muscles are very important to stretch. Tight calves can majorly affect your balance. We correct our balance when we lose our balance. The very first place our body tries to correct is at the ankles. So if you have weak ankle muscles, or if you have tight ankle muscles, your body is not able to kick in those muscles, or it doesn't have the range of motion to correct that loss of balance. And then you have to go to other strategies like taking a step. But tight calf muscles have been shown to increase your fall risk. So we'll talk a little bit about people with lower mobility, people who sit most of the day, or people who sleep in their recliner. I've come in contact with lots of people who, as they age, decide to sleep in a recliner because bed mobility is difficult, or they may have breathing issues and they can't lay flat. So people who sit a lot, or people who never lay flat because they never lay in a bed, they sleep in a recliner, they do everything in a recliner, their posture can be really bad. So some strategies for the chronic sitters: lay flat in bed for 10 minutes. That's everyone's favorite exercise that I give to people sometimes, to just lay flat 10 minutes. Only use as many pillows under your head during this time as necessary. So if you're laying flat to stretch out, you may want to only use one pillow. No pillows is ideal, but when you have the postural changes, especially with osteoporosis, the structure is not flat, so you need to have some pillows. Or if there's breathing difficulties, you also may need pillows to be able to breathe. If you're more mobile, you can stand up against a wall, working your time up to 5 minutes. The goal is to get as much of your body against the wall as possible, the back of the head, the shoulders, the backs of the arms, your rear end, legs, and then increase your time as tolerated. Those are two very simple things for people who sit a lot, whether they're, much older and have mobility issues, or if you're just somebody who sits at a desk for a long time. I want to take a moment to talk about frailty. The definition is at the top, but basically you have to meet 3 of the following criteria: weakness, slowness, low level of physical activity, self-reported exhaustion, and unintentional weight loss. So you can picture this in your mind. Frailty is a medical term. So all the research on frailty shows that the most consistent thing to reverse or prevent frailty is exercise. It is along with nutritional intervention. Some research studies show nutritional intervention, some have just looked at exercise, but because exercise affects all of these systems, your muscles, your bones, your hormones, your immune system. So adding exercise can help improve all of those systems, which can have an effect on reversing or improving frailty. Strategies for people with who don't move a whole lot. Maybe if you have a loved one at home that doesn't, they need help getting things done. These are some ideas to get them more mobile. So serving your meals at the table instead of serving people in their chair, walking to the bathroom rather than using a bedside commode. Grandchildren are like one of my best tools that I use. I get them involved in an activity with grandma, grandpa, throwing a ball, batting a balloon, helping them with their exercises if you're trying to get them to exercise, making your walk interesting by like having a bird feeder at the window to go look at the birds, engaging them in something that they enjoy. Using language, saying it's time to do your exercises rather than do you want to do your exercises. If somebody asks me, do I want to do my exercises? No, not always. But it's time. So it's time to go do this. Doesn't always work, but it's a better use of language. And habit and routine. This is what anybody who has an exercise program, you're going to be more successful with it if it's part of your daily routine. We are all driven by habit. We do much of the same thing every morning. We get up, we brush our teeth, we have breakfast, we watch TV. We get in our car and go to work, or whatever your routine is. Sliding that exercise routine into a spot in your routine that's already in place. If you have a paid caregiver, use them to help get your loved one more active. Write instructions down, tell them what you want to do, whether it's an exercise program that was left by their therapist, or whether it's a YouTube video you want them to help them with. Consider a Fitbit or an Apple Watch. You don't have to be walking 10,000 miles to be able to look at your progress of, 100 steps versus 150 steps, or hire a professional. There are professionals at gyms. There are professionals that come into the home like myself. And hopefully the fitness world is starting to take into consideration the needs of our older adults. For people who are very low mobility, or they're in their beds, they're bed bound, or they're using a wheelchair for most of their mobility, sitting unsupported on the edge of the bed for things like meals and bathing helps increase your postural stability. It helps with sitting balance, and it helps with breathing and digestion. Standing at the sink for ADLs, which are activities of daily living, like toothbrushing, brushing your hair, just that little bit of standing helps improve the use of your muscles, just to stand there. Rolling side to side in bed is a great core activity for people who are bedbound and not able to get out of bed very often. And then sitting unsupported or standing if able for periods of time, and you can time people for how long, make it a challenge to improve their sitting balance, standing balance, and core strength. So how do you do this? That's all good ideas, but where do you start? So we are in an age where we have tons of resources at our hands. YouTube, if there's an exercise you want to learn, it's on YouTube. So if you want to learn Tai Chi, it's on YouTube. If you want to learn yoga, it's on YouTube. If you want to do a seated exercise for people who are 80, it's on YouTube. It's all on YouTube. So the pros of YouTube is it's free. There's a huge amount of content, including lots of qualified physical therapists, fitness professionals. It's out there. The cons are that you got to go through a lot of stuff to find what you want. I know when I was doing yoga, finding one that fit what I wanted for that day was sometimes I'd spend more time doing that than I did the yoga. And they're generalized, they're not specific to the individual. Physical therapy. If you have a decline in function or you've had a fall, call your doctor and get a referral to PT. I'm a PT assistant. I'm a firm believer in physical therapy. I refer people to PT all the time. They are such a wealth of information. It's paid for by insurance. It's delivered by a skilled therapist, and it's tailored to the individual. The downside is it's short term. It's not a long-term solution to staying active. Senior centers. I think the one here in my community is getting ready to open soon. They're opening in many areas. So the pros of the senior center is they have more programs than just exercise. They have lots of social programs. It's fun to go see your friends. We're social beings. We like to be around other people. So the senior center classes fulfill that need as well. There's an instructor there if you're in person that can interact and participate, and they're generally low cost. The downside is group classes in general are generalized. They're for a group of people, not for an individual. They may be too hard for some people, or they may be too easy for others. And because of that, your form may suffer if the class teacher can only keep their eye on so many people, or you may not be progressing like you should. Virtual senior centers. I know most senior centers now have virtual online classes. There's no travel. It's low or no cost. Many times the instructors are still live and can interact. It depends on the platform that they're using. And again, the cons are they're generalized, not individualized, and don't have as much of the social component as the in-person senior centers. Utilize your caregiver. If you're hiring somebody to come into the home to take care of your family member or to help you out, you're already paying them. You might as well, pay them to do something like this. Oftentimes people are more cooperative for someone who's not their family member. I know this from personal experience. And the downside is that caregiver is not a professional and they can't progress the program or modify the program, and their knowledge is really limited to just what's on the paper. Personal trainers. I'm a personal trainer. You can go to the gym and hire a personal trainer. These will be individualized program geared towards your specific needs. They should be progressive. The downside is personal trainers are expensive. You have to travel to the gym. And if you are over 65, especially if you have any health conditions, make sure that you hire somebody who knows how to work with somebody with your health conditions, or that's worked with people who are older. Because when I did personal training when I was in my 20s, and I'm almost 50 now, and I will tell you, I did not know in my 20s what I know now about what it's like to age. So somebody who's had some experiences, it's important. Virtual trainers are all the new rage now. There's no travel, there's no contact. As far as, the whole COVID thing, it should be progressive and personalized. The downside is also the cost, and the downside is also there's not somebody right there. So I think when it comes to queuing people on form, virtual works very well, but if it comes to like higher, more difficult balance type of things, then it's a downside because you have to be very careful as a trainer what you do with people virtually. In-home trainers, the programs are individualized, they're progressive, there's no travel, the trainer comes to your home. Again, the cons are the cost, and make sure that your trainer is experienced and have worked with the clients with older adults or clients that have special needs. And I want to say something is that people sometimes think that they're like 80-year-old mom who uses a walker and can't go to the mailbox. They don't think about a personal trainer for her, but it's absolutely appropriate. My oldest client just turned 98. She uses a walker, and I've been seeing her for 3 years. She has dementia, and I see her 3 times a week, and she is still living in her own home. So if there's any questions, I would be happy to take questions.
Excellent. Thank you, Katrina. First question. I'm in my 70s. I don't do any weight or strength training. I don't like gyms, can't afford one. What can I do to get the necessary strength training?
Okay, so in home, I would say if you have access to YouTube, to look for in-home strength training for older adults. I guarantee you'll find something. You can do counter push-ups. Your body weight is an excellent way to provide resistance without having a bunch of equipment. Resistance bands are also easy to use in the home and low cost. You can get a set of resistance bands for like $25. And then many of the resistance bands comes with a little sheet that tells you what to do with them. So that would be a place to start.
Another question came in, says, a trainer I was recommended to had me doing, looks like up to 35 reps for weight training. Is that too much?
35 is a lot. I would say that if you're doing 35 repetitions, it depends on what your goals are. If your goal is to be able to do a longer time of doing something, maybe to have more endurance. But if you're looking to build strength, you should really be keeping it to 10 to 12, 2 to 3 sets of 10 to 12 reps. I will say that if somebody's not really experienced with older adults, they might be afraid to increase the weight. And this is not just an issue in fitness. This was something I saw in therapy. We were strengthening, but we were having people do in 20 and 30 reps of things, when really for strength training, to gain muscle mass, to build strength, you need to keep it lower reps, higher weight. And there's actually a movement within the PT world to actually challenge our older adults more by increasing the weight, not being afraid to give them weight. So maybe talk to your trainer about, well, do you think I can do more than this? And see what their goals are, what you're trying to achieve.
Excellent. Last question. I want to talk a little bit more about, how do you vet a personal trainer? I know you said, the difference where you are in your life, 20 versus where you are as far as age and experience. Yeah. What are the questions you should ask a personal trainer as far as if they're right for myself at my age or my family member who may be a little bit more advanced age?
I would ask them if they have any certifications there's several, older adult certifications, senior fitness specialists, functional aging specialists. So ask them if they have any experience, any certifications, and they've educated themselves. Education's great, but experience is even better. If they have experience working with older adults, and ask for a reference. See if they have worked with somebody who's 80 years old and had a walker. Ask if you can, call somebody to give them a reference on if they've worked with somebody who's older.
Excellent. Actually, there's one more question that just came in before we get your contact information. Somebody asked, Katrina, do you offer presentations like this to 55 plus communities?
I would be more than happy to do presentations like this anywhere you'd like me to do it.
Very good. Well, on that point, why don't you tell us how people can find you?
Sure. So the phone number at AgeWell Senior Fitness is 240-397-9050. You can check out our website at agewellseniorfitness.com, and I'm more than happy to take your emails at agewellseniorfitness@gmail.com as well.
Very good. And what areas are you at as far as if somebody's looking for in-person training?
We are in Maryland. We serve Frederick County, Howard County, Montgomery County. We are also the western areas of Baltimore County, like the Pikesville area, and then Anne Arundel County as well.
Excellent.
Not me.
Well,
I have peers that work for me. We're all vetted.
very good. Well, as far as Knowledgeable Aging, you can go to our website, knowledgeableaging.com, see all of our upcoming and archive webinars. Go to YouTube. I encourage you to subscribe. We update that a couple times per month. If podcasts are your thing, you could find us on Apple Tunes, Spotify, etc. Till next time, I'm your host, Jason Kotar. This is Knowledgeable Aging.